Hi, so I'm Lee. I'm an aesthetic doctor and aesthetic trainer at Cosmetic Centre. Today we're going to talk about Teyosdal Reddensity 2. Now this is a tear trough filler and it has low absorption of water, so it makes it great for putting small doses around the tear trough and try and build that volume. Okay, so I like to mark up the tear trough on the patient. I like to get them sitting forward so you can see under gravity. It's also quite useful if you keep their head aligned and you get them to look up at the ceiling, and it can exaggerate any volume loss or tear trough deformity. We'll use a cannula, so we'll use a 25 gauge cannula. I like to make an entry point here and also on the lateral aspect. Some people just make one entry point and then like to fill around. Personally, I like to do two. I just find it a little bit easier. Okay, so what I like to do is just to come medial, make your entry hole, and that's your pilot hole. We're just going subcutaneous. Once you've made your entry hole, you've got your cannula. I primed it with a Teyosdal Reddensity 2. And then I'm going to go in, pop through the skin, and then work my way up. Now with tear trough filler, you want to be under the orbicularis oculi muscle. You can sometimes see that it's quite hard to see on this model, but if you can really see the shape of your cannula, you know you're probably above the muscle. So just retract and you should feel a little pop. Once you're under the muscle, if you lift up your cannula, it's not as easy to see and you know you're in the right position. You can use this hand to also feel. Personally, I just like to do very, very small amounts of tear trough filler. You don't want to use too much at all and you're just filling that deformity. There we go. Some people, as I said, would then come in and fill from that hole. Personally, I like to come from the side, just lateral, stretch skin and make another entry hole. And this just gives me a bit more space and it makes it a little bit easier just to follow that deformity around. One thing to note, the orbicularis oculi muscle is quite tight on the bone here, or tight to the tissues underneath. So it is a little bit more tender when you come in from the side. And obviously there's a higher risk of a small bruise. So with tear trough filler, you want to undercorrect because it will still absorb a little bit of water. So I would never do more than 0.5 on each side, especially in one go. You can always add more in the future. And it's always good just to give it a little massage also, and just warn them that, you know, in 2 weeks, it will be more integrated and probably give a better aesthetic result.